Cancer is the leading cause of death in pets over 2 years of age, and small animal cancer cases are prevalent in the weekly caseload of every veterinary hospital across North America. Unfortunately, veterinarians are faced with limited availability of licensed treatment options, including challenges linked to handling off-label human chemotherapeutic agents, the availability of referral centers, as well as considering the budgetary guidelines of the client. Today, we want to introduce a new product that is a fully USDA-approved biological immunotherapeutic agent for the treatment of mixed mammary tumors and mammary adenocarcinomas in dogs. A mammary tumor is a tumor originating in the mammary gland. It is a common finding in older female dogs that are not spayed, but they are not just limited to non-spayed females. However, unspayed females have a 7 times greater risk of developing mammary neoplasia than do those that are spayed. When encountering mammary tumors, surgery is the most currently used method for treatment. Surgery involves the removal of the tumor and associated mammary chain to try and minimize recurrence. However, with the approval of Immunocidin, veterinarians now have a simple and highly effective therapeutic tool that is veterinary specific to treat mammary tumors in dogs. Immunocidin is so effective that veterinarians may elect to use it as their sole treatment option, or when used in conjunction with surgery in cases where the tumor is large and resection of the tissue could be a problem. Immunocidin is a valuable treatment option that also gives the surgeon a better tool to minimize metastasis. Immunocidin is based upon BioNiche's proprietary mycobacterial cell wall technology platform derived from Mycobacterium flae. It represents a significant advancement in therapeutic oncology options for either the veterinary oncologist and, most importantly, the general practitioner. Immunocidin works because mycobacteria, and especially their cell wall, have been known for many years to be active against a variety of tumors. The finished product is an emulsion of mycobacterial cell wall fractions which have been modified to reduce their toxic and allergic effect but retain their immunomodulatory and anti-tumor activity. The product is effective in tumor regression because it stimulates the activation of a variety of cytokines and lymphocytes, which in turn displays potent anti-tumor activity. And even though Immunocidin is administered by intratumoral injection, the response in dogs following injection is also generalized, and untreated sites frequently undergo regression. Immunocidin offers many advantages, not the least to mention is that it can be used safely with no risk to veterinary hospital personnel, and Immunocidin is far more cost-effective than chemotherapeutic agents. It is not only safer for the hospital staff, but it also has an excellent safety profile for the canine patient, including the older dog, while also having a high tumor-free survival rate. This is in contrast to chemotherapeutic agents, which can have significant side effects. These side effects are not seen when using Immunocidin because Immunocidin actually stimulates a dog's natural defense mechanisms to the tumor itself. The dosage in dogs varies with the tumor size, but 1 ml should be considered a minimum dose. Individual doses can range from 1 to 30 ml. However, the average dose is about 2.5 ml. Treatment should be repeated at 1 to 3 week intervals, and typically, most cases will require 3 to 4 treatments. As a result, the average cumulative dose per treatment regimen is about 10 ml. Following use, there may be some initial swelling as the immune system is responding to the tumor. As the tumor cells die, the immune system will resorb the dead cells. One other characteristic as the tumor dies, especially if it is superficial or near the skin surface, is that it may develop a discharge. This is normal and a good sign as it is the necrosis of the tumor. And with Immunocidin, only the tumor tissue is destroyed. The healthy cells are not affected. When using Immunocidin, the immune system will clean up the dead cell debris and the body heals the site in the same fashion as a normal wound. The typical clinical results when using Immunocidin is that more than 90% of dogs will respond with a greater than 50% reduction in tumor size, and anywhere from 65 to 85% of dogs will go into remission. Results are dependent on the severity and progression of the tumor. The veterinary cost per vial is $195, and Immunocidin has a 3-year expiration date. Thank you for taking the time to learn more about Immunocidin, a revolutionary new immunotherapeutic from BioNiche Animal Health.